It's my proud privilege to welcome a seasoned healthcare leader with over 19 years of executive experience across multi-speciality and super specialty hospitals, known for driving sustainable growth, operational excellence, and large-scale institutional transformation. Dr. Rakesh Shah. Dr. Shah holds executive education in hospital management from IIM Ahmedabad and an MBA in healthcare management supported by a strong clinical foundation. These qualifications enable him to effectively integrate strategy, operations, and care delivery. Currently, Dr. Shah serves as the Chief Operating Officer at KEM Hospital Pune, playing a pivotal role in KEM Hospital's transformational journey. Recognized as a revenue growth specialist and operations excellence leader, Dr. Shah is recognized for his expertise in revenue growth and operational excellence. Welcome, Dr. Shah. I would like to ask you, as the COO, how would you describe the current scale and scope of operations at KEM Hospital in terms of patient care, infrastructure, and outreach service?
Thank you for having me here. When I look at KEM Hospital Pune, I don't look at it just an infrastructure. I will say it's a living ecosystem of care. Our expertise go beyond the hospital walls. We host 568 beds, which includes 130 critical care beds, advanced centers like our critical care units, dialysis unit, high-risk obstetrics. We touch thousands of lives every day through our outpatient departments, through our inpatient departments, through our operation theaters, and through our cath labs. I see scale of operations is not about the numbers. It's more about the complexity, what we deliver, and the consistency of the care delivery over decades, rather over century. Which is the scale of operations. We go beyond our hospital walls. We do a lot of community reach, lot of community awareness activities, lot of research, which is spread across Pune and around the peripheries. Hospital operations scale, it's more about its impact on community. That is how I look at KEM.
Sure. Very interesting. So, this is something which actually goes into your brand value and strengthens it. So, it's very nice to hear that. Many departments at KEM Hospital have earned recognition as centers of excellence. Which are these departments and what specific strengths or outcomes set them apart?
So KEM Hospital Pune comes with a rich legacy and many centers of excellence. When it comes to centers of excellence, it's not about infrastructure. It's about consistency of outcomes at what we deliver the care. It's the expertise and it's the continuous growth in terms of academic as well as research. So to name a few, we have our centers of excellence, high risk obstetrics, which is our core, our renal department, our transplant programs, our critical care units, our neonatology, our pediatrics. These departments over years have stood as a centers of excellence. And again, these are centers of excellence because of its consistency in outcomes, its continuous innovation, and its continuous improvement in quality of care, which impacts to the patient's life.
Okay. So, drawing on the word excellence, the excellence is also related to expectations.
Yes.
Okay. So we have, and I'm sure I am asking this question on behalf of the public here, the people who come to you as for your medical services. We look for excellence, yet we don't have deep pockets. We want the best at the lowest. So how do you deal with that kind of mindset, if I may say that, and how do you deliver so that I go back satisfied, feeling that I have got value for what I have spent without overspending?
So it's a very interesting question. At CXO levels, we deal this question every day. Because you see, healthcare, it's all about innovation, technology upgradation, and all this requires a cost.
Yes.
And at the same time, as you rightly said, that ki expectations of about excellence in quality of care. At the same time, there are expectations about the cost to the
Yes.
patient. So here we implement certain strong policies which are mostly about operational efficiency, a smarter procurement, a very efficient supply chain management, and at the same time the mix of the standardization of quality and clinical pathways, wherein we work on reducing length of stay of the patients, so it actually impacts to the care, improved care. We adopt the technology advancements. Our clinical expertise are so, wherein we focus on daycare surgeries, shorter stay surgeries, lesser complication rates, and this is all achieved through combined effort by the clinical expertise and operational excellence. I know it is a very tight rope for us to work on that, but over the period we have consistently able to do it. And what makes us to stay updated with this is our core clinical and core pillars of our these institutes, wherein we have always believed in accessibility, equitable care. There, this is the right word. I would like to frame it. It's about equitable care, wherein clinical expertise, operational excellence, and data-driven decisions support system, and the leadership plays a very crucial role.
Absolutely. So the kind of loyalty that you have cultivated over the years goes to show that what you're doing is, you're doing something really right for people to value you, to come back to you, to be associated with you, which is really credible.
Yeah.
So that's really nice to hear. What are the hospital's key focus areas in terms of expanding or strengthening these excellent centers that we spoke about previously in the coming years?
We all know that healthcare is changing very rapidly. How we deliver this, we are working on building and leveraging our core strengths, which are centers of excellence. We have steadily moved over decade or years from 4-bedded hospital to 568 tertiary care unit. So our focus is more on the cardiology, interventional neurology, high risk obstetrics, neonatology, and as well as more about oncology, wherein we are able to deliver what is needed today. One important aspect in today's era is geriatric care. So geriatric care is becoming a huge need, and through our human touch practices, wherein we are working on developing certain center of excellence in our geriatric care medicine, which will be able to cater to the masses, and that is a need of our. We don't go just about treating. More focus is given on the preventive health checkups, screening camps, because I personally feel cost of healthcare can be reduced with the continuous preventive health checkup campaigns which are run across, and more involvement of community will add value to our this mission. Centers of excellence are evolving. We are pioneer in transplants, so our focus is on transplant program. When I say transplant program, it's kidney transplant, it's liver transplant, and bone marrow transplant. And I'm proud to share with you, we are one of the units wherein who is equally mastered the art of transplantation, not only in adult space but in the pediatric space as well. And we have the complete backup system to deliver this transplant program. So in a nutshell, cardiac sciences, oncosciences, high-risk obstetrics, neonatology care, and transplant program will be our focus areas in coming years.
Truly wonderful. That's very inspiring. This conversation would not be complete if we didn't touch upon technology. So, can you tell us how technology is being integrated into daily hospital operations, from diagnostics and treatment protocols to digital health records and patient engagement?
So, we all talk about technology. So, technology is not just an add-on. I look at it as a foundational. But what sets us apart is we are trying to use technology in intelligent way. Because when you go into the market, you will find so many AI, so many technological driven solutions. But what remains core is the human touch. So we are integrating our diagnostic systems with the high-end technologies. We are moving towards high-end surgical work through minimally access, and electronic health records, which really helps us to improve our operational efficiency, to have a more coordinated effort between the departments, seamless information exchange, improving the patient outcomes. And I look at technology as a place wherein we should be meaningfully in a position to deliver a safer, a faster, and a reliable care. If I have to say last word, we are at KEM looking at not a high-tech hospital. We are looking at a high-trust hospital with the use of technology.
Wonderful. And it's very heartening to note the kind of human touch that you reiterate, because if I were to come to you, I would be so overawed and enamored with the automation and the AI, etc., the technology. What I, and I'm sure most of us, would be seeking is a human touch.
Yeah.
So that is something which is very promising, and of course it works wonders for people like me and many others who look at a human touch in an institutional or hospital kind of an approach. Having said this, there is a whole lot of redundancy that can creep in if we don't hone our skills, if we don't work on what we have been practicing for years. So I believe, and I'm sure you'll agree, that research plays a very critical role. So if I were to say that research is a critical pillar in healthcare institutions, what ongoing research initiatives or collaborations is KEM Hospital currently involved in, and what impact are they creating? Are they measurable? Have you been able to see the impact?
So, when we talk about institutions, what sets institution apart from a hospital is the collaboration between the hospital care delivery, a diagnostic center, and a research, because medicine is changing very rapidly, and what keeps us with that pace is the research. And we are really proud. We have a separate research vertical which is rendering services and being one of the finest institutes in the country, in Asia as well, when it comes to research. So a very ground level research is happening for more than 50 years. The research focus areas are maternal health, chronic lifestyle disorders, NCDs like diabetes, hypertension, and renal. What we are doing in this research, we are going to the society, community with our peripheral reach, a dedicated team of researchers, dedicated field workers, collecting the real-time data. When you see research slightly a technical thing, we see all the research coming from West. But we are Indians, or Asian population is different from Western. So we need to have our own research which will be able to give us the outcomes or the advanced care. And KEM Hospital's Research Center is one of that pioneer in this field. In terms of and recognition is taken by the lot of international journals like Lancets and many other bodies about KEM research. So research is going to be there, and it helps us to keep updated. It helps us to contribute to the evolving medicine development.
Very nice. That's a very progressive approach and something that will hold you in good stead in the coming years. One of the major challenges for healthcare are lifestyle diseases and aging populations. So what strategic steps is KEM Hospital taking to remain future ready while maintaining affordability and accessibility? Because these are key. You want to be future ready, but we want affordability.
So I think this is one of the very interesting question, and it's tricky for me also to answer, because it keeps me going like 19 years experience doesn't add value. It's a real challenge. And when it comes to KEM Hospital Pune, we are continuously focusing on how can be future ready. When I say future ready, very strategic expansions in terms of our capacity building. When I say capacity building, it's about infrastructure as well as manpower. So capacity building is happening on a state-of-the-art infrastructure units. we are developing our centers of excellence as a one wholesome unit, wherein everything is comprehensive care is delivered. So our neurosciences department is such, our critical care units are such, our renal unit is such. Similarly, we are upgrading our infrastructure and the patient flows to make it more patient friendly in the existing hospital. A lot of emphasis is given on subspecialty. Many people are looking at the tertiary care, but what is changing in today's environment is the subspecialization. Earlier, we used to go to a physician for all our illnesses, like whether it is cardiac, diabetes, or stroke. Nowadays, things are changing. People are looking at stroke specialists, people are looking at interventional cardiologists, people are looking at pediatric cardiologists, pediatric nephrology, pediatric endocrinology. So all this subspecialization is the focus area for us, and it's not about only infrastructure. In a skill development, a capacity building of trained resources, making them available. We run one of the Pune's very leading and advanced academic program, wherein we are not only looking at capacity building for KEM Pune only, we are looking at capacity building for the country by training the experts in this subspecialization area of pediatric nephrology, of cardiology, and so on and so forth. So this is one thing which we are continuously focusing on, making us a future ready. While doing that, it's a human touch which remains at the forefront. You rightly mentioned how to make a balance between the affordability and accessibility. For us, both words are not opposite. They are rather synonyms, they are rather partners. And hospital care delivery is about human, it's about high trust, and that's why we are proudly calling us, or rather not only us, our people call us, our community calls us as a hospital with a heart.
Wonderful. That is something so heartening to hear. And with the kind of enlightening talk that we've had, where you've outlined accessibility, approachability, human touch, all these things shine through. And I wish you all the best in your future endeavors, with people like you at the helm, leading KEM Hospital with the right vision, the right mindset, and the human touch. I'm sure we are going forward in a very good future ready way. So thank you so much for joining us, and it was a pleasure having you with us today.
Thank you very much. With this platform, I would like to urge people. We have been listening, especially our generation have been listening about having a family doctor. I think it's time has come wherein we talk about a family hospital, because care delivery is not limited to one specialty, it's a multidisciplinary thing. And when I talk about multidisciplinary thing, so you need to have a family hospital wherein everything is available under one roof, and that is what differentiated KEM for years together, a family hospital with multidisciplinary care under one roof. Thank you.
Very interesting. Thank you.